to talk today to the chronic pain patients about the pain scale. We've all seen them in the doctor's office. It goes from 1 to 10 and has little pictures with smiley faces or teary faces. And there are chronic pain patients need to know a couple of things about charting your pain. And they're sort of at odds with each other, the 2 points that I'm going to share with you today. The first point is you need to be able to establish clearly with your doctor that you're in pain. And then you need to be able to sort of objectify the pain on a pain chart, so that the doctor knows if your pain changes or not. So you need to be forceful to establish that you're in pain, which may be a little bit higher on the chart, and I'll tell you what the numbers on the chart are in a second. But once that's established, you want to be very honest about staying within the numbers when you talk to your doctor, because if you jump from a 5 to a 7, and that's a big jump in pain. If you told your doctor last visit 5 and 5, when you go to 7, you want your doctor to know that that's a big increase for you. So I've heard people go into, I've sat next to them in the waiting room, and the doctor will come out and they'll say, the person's sitting there next to me normally, and the nurse will say, "How's your pain today?" And they'll say, "Oh, it's about a 10. Well, it can't be about a 10, because 10 will start at the high end. A level 10 of pain is you're either in shock or unconscious, because I've been both. So someone sitting in a chair is not a level 10 pain, and it's completely dishonest to use a level 10 number. As a matter of fact, you cannot tell a doctor you're in level 10 pain. You can't communicate at that level, because you'll either be in shock, which means your whole body just kind of shuts down, but you still be conscious, but your body, the pain is so intense at that level that your mind just shuts off from the pain, and you literally go into shock. And with me, there's extreme danger of a heart attack, because my pain it gets so high when I get to that level. And the other one is, and I've had this happen a couple times, the pain is just so bad that I just pass out, and that's a level 10 pain. Okay, level 9. Again, if you go in and tell your doctor, "What's your pain?" I'm about a level 9. You won't be saying that with a clear voice. A level 9 pain is almost accompanied by extreme anger and a desire to hurt yourself, either suicidally, or what I sometimes do when I'm in a 9 is I'll slam my hands against something concrete. I've cut myself a few times. But you want to transfer the extreme chronic pain into some acute pain. It's very dangerous at that level, because suicide is very possible. And a level 9, you can't stay at that level very long, because the anger and the pain are so intense that you will harm yourself one way or another, or you will slip into a level 10. And my dogs sound like they're about a level 4. A level 8 is... level 7 and 8 are kind of hard to describe, because then you get into some transitory stuff. For me, I know when I'm getting to over a 6. Over a 6 is just like, for me it's about like if I hit my thumb with a hammer. That's like my everyday pain. But it's chronic, so it's not, but it does pound and stab in my lower back, very much like maybe 5 minutes after hitting, because I used to do carpentry, hitting my head with my thumb with a hammer. So that's about a level 6. Level 6 is extreme pain. As you notice on the charts, I mean, from a 10 to a 9, you can't even express it. And so we'll start at 6 and move to 7 and 8. When I get to 7, I notice that I have involuntary tears. and I cry. I'm close to 7 now because tears are coming down my face. I'm not sad. I just can't prevent myself from crying, and become extremely emotional. I mean, I cry at dishwashing detergent commercials on the television when I'm at level 7, and I'm sort of borderline that right now. At level 8, I you start. It's kind of funny. Level 8, you start to slip into the anger of a level 9, or you become extremely emotional. This depends on the person, because I've seen people that I know. I know a person who has had second and third degree burns over 60-75% of her body, including her entire head, and she's had skin grafts for most of her life. So she knows pain better than I do, because she's experienced between the 8 and 9 level a lot. She probably lives at between a 7 and an 8. So the 8, you're going to be either extremely emotional or just really edgy, and maybe both, because the pain is now so intense that you are losing mental control at an 8, and at 9 the control is gone, and at 10 you're gone. So that's some. And 5, 4, 3, 2, 1. If you're at a 5, be happy. People who are in chronic pain really suffering would give anything for a 5. That's all I have on this one.